Healthy teeth matter far beyond a bright smile. At the simplest level, teeth let us eat, speak, and express emotion, functions we take for granted until something goes wrong. But the importance of maintaining healthy teeth reaches into overall health, confidence, and even finances. Poor oral health can lead to pain, infections, difficulty eating, and speech changes. It can also contribute to systemic issues. Research links gum disease with heart disease, diabetes complications, respiratory infections, and adverse pregnancy outcomes. So, keeping teeth healthy isn't cosmetic or optional, it's a cornerstone of daily well-being. Caring for your teeth supports quality of life. When you can chew comfortably, you absorb nutrients better, which fuels energy and supports immune function. When your mouth is free from chronic pain or bad breath, social interactions and self-esteem improve. Employers and colleagues notice confidence. Patients and partners notice it too. For children, healthy teeth affect development. Proper bite and jaw alignment influence speech and facial growth. For older adults, preserving natural teeth helps maintain nutrition and independence. These real-world impacts show why dental health is a public health priority, not just a personal preference. Consider two practical examples. First, a parent who follows regular brushing, flossing, and dental checkups for their child can prevent cavities that otherwise require fillings or crowns, saving pain and future orthodontic complications. Second, an adult who treats gum disease early avoids more serious conditions like tooth loss, costly implants, and the increased cardiovascular risks linked to chronic inflammation. Both examples illustrate prevention's power. Small daily habits and timely professional care drastically reduce long-term costs and complications. Experts generally agree that prevention is the most effective approach. Dentists emphasize routine cleanings and plaque control. Nutritionists highlight limiting sugary and acidic foods, and public health advocates push for community water fluoridation and accessible dental care. Still, there are challenges and differing viewpoints. Access to affordable dental care remains uneven, and some people distrust fluoride or resist dental treatments due to fear or cultural beliefs. Overcoming these barriers requires education, policy solutions, and empathetic clinical care. Maintaining healthy teeth ties directly into the 7 practical strategies we'll cover next: daily hygiene, diet, fluoride use, regular dental visits, protective measures, managing underlying health conditions, and lifestyle habits like quitting smoking. Each builds on the prevention-first mindset introduced here, showing how routine choices protect both oral and overall health. Daily oral hygiene fundamentals are the everyday practices that keep your mouth clean, your teeth strong, and your breath fresh. At its core, this means brushing, flossing, and rinsing in a consistent, correct way. Brushing twice a day for 2 minutes removes plaque, the sticky film of bacteria that causes cavities and gum disease. Use a soft bristled brush and fluoride toothpaste, angling the bristles toward the gum line and using gentle circular motions instead of harsh back-and-forth scrubbing. Replace your toothbrush every 3 months or sooner if the bristles fray. Flossing once a day reaches the spaces between teeth where a toothbrush can't. Slide the floss gently up and down against each tooth, curving it into a C shape to hug the tooth surface and beneath the gum line. If traditional floss is difficult, try floss picks, interdental brushes, or water flossers. Each is effective when used properly. Rinsing with an antiseptic mouthwash helps reduce bacterial load, so consider a fluoride mouthwash if you need extra cavity protection or an antiseptic rinse for gingivitis prevention. Mouthwash is a supplement, not a substitute for brushing and flossing. The significance of these fundamentals can't be overstated. Consistent daily care prevents decay and periodontal disease, reduces the need for fillings and costly dental procedures, and preserves natural teeth into older age. Good oral hygiene also impacts overall health. Research links gum disease to conditions like diabetes and cardiovascular disease. So what you do at home matters beyond your smile. Practical examples include a busy parent who sets a 2-minute timer and brushes with their child to build routine, and an office worker who keeps a travel toothbrush and interdental brushes at work to clean after lunch. Athletes might use mouth guards and emphasize rinsing after practices to clear sugars and acid. Dentists commonly advise electric toothbrushes for people with limited dexterity and floss holders for those with tight spaces between teeth. Challenges include sensitive gums that bleed when starting flossing or dry mouth that increases cavity risk. If bleeding occurs, keep flossing gently and consult a dentist. Bleeding often improves as inflammation subsides. For dry mouth, increase hydration and consider saliva substitutes. These daily fundamentals connect directly to other oral health strategies like diet choices, professional cleanings, and lifestyle changes, forming the foundation for lifelong dental wellness. Nutrition and lifestyle choices that protect your teeth are about more than avoiding candy. They shape the environment in your mouth every day. Start with a clear definition. Nutrition refers to the foods and beverages you consume and the nutrients they provide. Lifestyle choices include habits like smoking, alcohol use, sleep, and stress management. Together, they determine acid exposure, bacterial balance, saliva production, and the availability of minerals your teeth need to stay strong. This matters because teeth are living structures that rely on saliva and nutrients to remineralize enamel and fight decay. A diet high in fermentable carbohydrates and acidic drinks promotes harmful bacteria and enamel erosion. Conversely, diets rich in calcium, phosphate, vitamin D, and fluoride support repair and resilience. Lifestyle choices like smoking reduce blood flow and saliva, increasing risk for gum disease and tooth loss. So what practical choices protect your smile? First, choose tooth-friendly foods. Dairy like milk, cheese, and yogurt are rich in calcium and casein, which help remineralize enamel. Crunchy vegetables and apples act as natural toothbrushes, stimulating saliva and mechanically removing plaque. Nuts provide phosphorus and healthy fats. Two clear examples. A mid-afternoon snack of plain yogurt with nuts supports enamel. Swapping soda for water with a meal reduces acid attacks. Second, limit sugary and acidic foods. That includes obvious sweets and hidden culprits like fruit juices, sports drinks, and vinegar-based dressings. Frequent sipping prolongs acid exposure. Instead, consume these items with meals and rinse with water afterward. Third, hydrate and support saliva. Chewing sugar-free gum stimulates saliva, which neutralizes acids and carries minerals back to enamel. Saliva-replacing products are helpful for dry mouth caused by medications or medical conditions. Fourth, avoid tobacco and limit alcohol. Smoking increases plaque, stains, and gum disease. Alcohol can dry the mouth and often accompanies poor oral hygiene. Quitting tobacco and moderating alcohol dramatically lower oral cancer and gum disease risk. Recognize challenges. Cultural diets, income limitations, and medical conditions can restrict access to recommended foods or complicate changes. Some argue strict avoidance of all sugars is unrealistic. A balanced, sustainable approach that reduces frequency and pairs sugary foods with protective ones works better. Connect this to other oral health practices. Nutrition amplifies the benefits of brushing, flossing, fluoride use, and regular dental visits. When combined, mindful eating and healthy habits create an oral environment where teeth can repair and stay strong for life. Preventive care starts with regular dental checkups and professional cleanings, the backbone of keeping teeth healthy. A dental checkup is more than a quick look in the mirror. It's a systematic evaluation by a trained clinician who inspects teeth, gums, bite alignment, soft tissues, and oral hygiene. Professional cleanings, typically performed by a dental hygienist, remove plaque and tartar buildup that brushing and flossing alone can't eliminate. Together, these visits detect problems early, prevent progression, and maintain long-term oral health. The significance of these appointments can't be overstated. Early detection of cavities, gum disease, or oral cancer means simpler, less costly treatment and better outcomes. Removing hardened tartar reduces inflammation and prevents periodontal disease, which is linked to heart disease, diabetes complications, and other systemic conditions. Regular checkups also provide opportunities for personalized advice. Fluoride treatments, sealants for kids, or tailored home care routines that address individual risk factors and keep small issues from becoming major ones. Consider two common examples. First, a routine cleaning reveals a small cavity forming between teeth. Treated promptly with a filling, the tooth is preserved. Without that visit, the decay could progress to root canal or extraction. Second, periodontal probing during a checkup can uncover early gum disease. With scaling, root planing, and improved home care, the patient avoids bone loss and tooth mobility that might otherwise require advanced surgical therapy. Another real-world application is the use of dental X-rays during checkups to spot hidden decay or impacted teeth, which guides preventive or orthodontic decisions. Many dental professionals and public health experts strongly recommend checkups every 6 months, though some patients with low risk may need them less frequently, and high-risk patients may need more frequent visits. Critics sometimes argue that twice-yearly visits are unnecessary for everyone and cite cost concerns. This is where individualized care plans matter. Dentists assess risk and recommend schedules that balance benefit, cost, and patient circumstances. Challenges include access barriers, cost, limited insurance coverage, fear or dental anxiety, and geographic limitations in underserved areas. Mobile clinics, community programs, and patient education can help bridge gaps. Preventive visits also tie into other aspects of dental health. They reinforce daily hygiene habits, inform dietary recommendations, and connect oral care to overall wellness. In short, checkups and cleanings are proactive investments that save teeth, time, and money, and form the foundation of any effective long-term dental health strategy.